175 people a day. If you do the math, it's almost 64,000 people a year in America will die of a drug overdose. Opioids are considered the most addictive drugs, as witnessed by the epidemic we have in this country. Treatment goes well beyond just detox. And joining us with how they can help get people sober and help them stay sober is Vaughn Gilmore, who oversees the addiction programs and the Menninger Clinic, and peer counselor Gordon Meltzer. Good morning.
Good morning.
All right, drug addiction, it's been there for decades and decades and decades, but we're at an epidemic level today. There are different pathways that somebody may become an addict. Let's kind of go through that.
Sure. I mean, addiction can develop for a number of different reasons. You mentioned self-medication related to depression or anxiety, just social drinking if you're drinking enough. It's that repeated exposure of the brain to substances that leads to addiction. It doesn't really matter why somebody's using.
Yeah, all right. The only thing that might differ is a little bit of how treatment might be on the back end, depending on how that happened for you. Okay, for you, Gordon, when was the first time that you picked up a drug and realized I have a problem?
13 years old.
Yeah. And how did that happen?
It happened because I had to have something different, and I thought I had found it in drugs.
Which that goes back to that self-medicating type of thing, right?
Sure.
And what people, especially those who are dealing with mental illness, need to know with the right medication, they can be fine. It doesn't have to be those other substances. All right, when it comes to treatment, a lot of times people think in the outside world, the outside looking in, detox. Once you detox, life should be fine, right?
Sure.
Yeah, and you smile and say, all right.
I made that mistake.
Yeah, but it's not. And at Menninger, it's beyond the detox.
Absolutely. Detox is really just the beginning. Treatment really should be provided by licensed master's level or higher mental health and addiction professionals that can help somebody understand sort of the drivers of their addiction, help develop a thorough recovery plan, and sort of get somebody started on the path of recovery.
Yeah, and of course with addiction, again, those from the outside looking in, it's kind of like with mental illness. People will say, snap out of it, just stop. It's not easy to just stop.
It's not easy, but recovery is a reality today, Deborah.
Yeah.
But with treatment, with an instruction manual, we can't do it alone. I couldn't do it alone. I needed treatment at the Menninger Clinic, and I needed continuing support from peer support groups, in my case, Narcotics Anonymous.
Yeah, all right. So there's a point where, for every addict that I know, where they were brought to their knees, and they were like, this time it has to be for real. What was that point for you?
A suicide attempt by overdose.
All right. So when someone comes in, I think one of the things that people are afraid of is being judged, because they have been judged by friends and family, those closest to them.
Sure.
So the first thing is there's no judgment.
Absolutely. You know, we know that only about 11% of people in the United States that need specialty addiction treatment actually receive it. And a lot of that has to do with stigma. We also know that the sooner somebody sort of gets treatment earlier on in their addiction, the greater chance of recovery. So we want people to seek treatment as soon as they're concerned about their substance use, or speak to a loved one as soon as you're concerned about their substance use, and get them treatment sooner and sort of take some of that stigma out of it.
Yeah, and also there's some myths out there. I heard a kid say the other day, well, I'm not worried about it because I heard it has to do with your DNA, which there can be a DNA component to it.
Yeah.
But the fact of the matter is, anyone dealing, especially with opioids, you do it enough, you're going to get addicted. And it doesn't take a lot.
Really, it doesn't take very long with opioids at all. Yes, family history, like sort of genetics, play a role in someone's risk of developing addiction, but enough exposure to something like opioids, alcohol, anxiety medications like Xanax, any of that can lead to addiction.
And Gordon, for you, how important, when you say you're a peer counselor, how important is that peer relationship to helping somebody in their recovery?
It was vital for me. I only have my own experience to speak to. And when I was a patient at the Menninger Clinic, I was treated, stabilized for mental illness and addiction, was told, well, we can't fix you in 8 weeks, but we can suggest that you engage in a program of recovery, and you'll need to do that for a long time.
They give you the tools to work with.
Absolutely, and the hope that there could be a life worth living.
Yeah, all right, and you've been sober how long?
2,900 55 days, 6 years, 3 months, and 15 days.
Congratulations.
But who's counting?
Yeah, well, who's counting is that you don't take for granted every minute that you're sober.
I believe that I have a one-day reprieve, 24-hour reprieve from a chronic, progressive, and potentially fatal disease, yeah.
And as I always say, sometimes you don't choose a mission, the mission chooses you. I said that to Dr. Elizabeth Mackinville as well, and the mission chose you as a peer counselor. Thank you very much. Well, legendary actress Patty Duke lived with bipolar disorder. Her son, Sean Astin, recently shared his experience growing up with a mom battling mental illness. First getting a diagnosis, then trying to figure out how to manage it.